Hey everyone, my name is Avaneesh Kunta, and I'm a second-year medical student at the UCF College of Medicine in Orlando, Florida. So my project is titled The Community Income and Kidney Stone Surgical Delay, and it's focused on understanding the influence community-level economic factors can have on surgical delay of kidney stones in communities within Florida. So previous studies have shown how patient socioeconomic status is significantly associated with surgical delay. However, the precise effect of community income and surgical outcomes has been underexplored, more specifically within the field of urology. So given the large amount of communities within Florida that have limited access to healthcare, the goal of our team was to try and identify some of these communities within the state that may face higher risks of delays in an effort to improve kidney stone outcomes. So to do this, our team used two large data sets. So one of our data sets provided by the Healthcare Cost and Utilization Project, also known as HCUP, provided community level economic, it provided EHR data for patients in Florida that visited an emergency department for kidney stone care. The other data set, the AHRQ, otherwise known as the Agency of Healthcare Research and Quality, they provided several community level economic variables, including median household income, proportion of population below or above the federal poverty level, and proportion of the population that was on food stamps, etc. So what we did was we merged these two data sets together and indexed them by Florida zip code tabulation areas to generate a final data set that provided both economic variables and median time to surgery. Median time to surgery being our outcome. From there, we conducted a MANOVA analysis and looked to identify significant predictors for surgical delay. So for the purpose of this abstract, we decided to focus on federal poverty level as a primary predictor for surgical delay. Our analysis identified 7,401 patients within 304 Florida zip code tabulation areas. Communities are going down this figure here. We can see that communities that had a higher prevalence of patients in the lowest federal poverty level, which in our case was below 1.37 of the federal poverty level, were significantly associated with increased surgical delays, so 28 days or more. And conversely, we found that communities with a higher prevalence of patients, in this blue color right here, in the highest federal poverty level, which is 4 times or more the federal poverty level, actually were found to have significantly lower surgical delays. So you can see the slope down here. Down here in this table, you can kind of see the more exact values for the p-values and the slopes for each individual federal poverty level. But all in all, this study really highlights the impact that economic context and economic variables within communities can have on kidney stone surgical delay. It's clear that lower income communities are potentially at greater risk for increased surgical delay with respect to kidney stones, potentially even exacerbating their conditions and leading to more invasive treatments later on. That's even more concerning because then there's a risk that there's even greater healthcare costs and burden to these patients and potentially to also hospitals in the future. This study helps to, or this study is part of like a growing literature dedicated to understanding, identifying, and addressing socioeconomic disparities and their respective impacts on patient outcomes. Our hope is that this data may help to tailor future Florida healthcare policies and interventions and allow healthcare providers to be more proactive in treating these at-risk populations. Some potential Florida healthcare policy examples include redirecting more funding to these at-risk communities, providing more healthcare literacy for these communities, and to allow them to be more proactive in kidney stone management and taking part in more preventative care, and potentially even establishing community-level care centers like student-run free clinics to provide care for these communities. Below that, you can see all the references that I have for this abstract, and I'd like to thank my mentor, Dr. Hubert Swana, who helped guide me through this project, and for the UCF FIRE program for funding this experience. Any questions?
Great. Thank you so much, Avaneesh. I do have one question. So aside from treatment rates, is there any difference in the incidence of kidney stones across the zones that you have?
That's a great question. That wasn't something that we studied within this project, but actually one thing we are looking at is for the manuscript for this project, we're looking at decompressive surgeries as another metric. And from there, we can see whether or not there's a larger amount of decompressive surgeries being done for these lower populations or lower income populations or higher income communities. And that was kind of add as another layer to kind of give us an idea of whether or not these patients are given these more invasive surgeries. It's actually another project being undertaken by someone else in our group. So it's a great question. Definitely looking into that.